Does BP medicines harm kidneys?
Hypertension or high blood pressure damages the kidneys. But if you take the medicines and control your blood pressure, your risk of kidney disease actually reduces.
Some people have very high blood pressure whenever they see the doctor. Rest of the time it's all normal. So what is this?
Yes, there is an entity called white coat hypertension. So at home or outside, you're absolutely fine. As soon as you enter a hospital, a clinic, or a doctor comes close or touches you, there is a fear what will happen, and that fear raises your blood pressure. And this is called white coat hypertension. It is now proven that your nighttime blood pressure is very closely associated with your risk of having heart disease or stroke.
Sometimes spouses complains of their partner snoring too much. So does this have any connection with hypertension, high blood pressure?
Yes, this is a condition called obstructive sleep apnea, which is very common with very obese people. Your partner sleeping at night is not something to just ignore, it requires serious medical attention.
Doctor, if the BP is low, then is it true that the risk of stroke and heart disease is also low?
Because hypertension is one of the important risk factors, but it is not the only risk factor for heart disease and stroke. Besides hypertension, there are many other risk factors like diabetes, obesity, smoking, stress, physical inactivity. It is preferable to take your BP tablets at night time.
Hello and welcome to Heart Talks, where we bring you expert insights. In simple words, we help you to take charge of your heart health. I am your host Jenny, and today we are going to talk about something that affects millions of hearts silently: hypertension, high blood pressure. Why it is called a silent killer? How can you know your numbers? And most importantly, what can you do about it? To have all the information, to have all the answers, and to know more about it, let's talk with our expert for today, Dr. Anand Ahuja.
I'm Dr. Anand Ahuja, interventional cardiologist with Rhythm Heart Institute, and I've been into this cardiology practice for the last 20 years.
A very warm welcome, sir. Glad to have you here. And today I have so many important questions related to hypertension. And the very first and important question is, how should one monitor hypertension?
Well, hypertension is a silent disease, so do not depend on symptoms. Always buy a digital home blood pressure recording device which you can tie around your arm, and it can just check your blood pressure at the stroke of a button. Do it every week if your blood pressure remains okay, and keep it under control so that you can remain disease free for a very, very long time.
All right, that's really useful information. How much should target blood pressure be?
Well, for most of us, our target blood pressure should always be below 130/80. So that is, your upper blood pressure should be below 130, your lower or diastolic pressure should be below 80. If you are very elderly or frail and there is a risk of fractures or fall, you may allow your blood pressure to stay up to 140 or 90. But for most practical purposes, almost majority of us, 130/80 should be your target. Always stay within this range.
All right. Some people have very high blood pressure whenever they see the doctor. Rest of the time it's all normal. So what is this?
Yes, there is an entity called white coat hypertension. So at home or outside, you're absolutely fine. As soon as you enter a hospital, a clinic, or a doctor comes close or touches you, there is a fear what will happen, and that fear raises your blood pressure. And this is called white coat hypertension.
All right.
Although we can mostly reassure that person that he actually does not have blood pressure, but this is not a completely benign condition also. You have to keep a close watch on his blood pressure. In future, he is more likely to develop hypertension than someone who does not raise his blood pressure even when seeing a doctor.
Okay.
Yes.
So psychological effect does happen.
It's completely psychological.
And what is the ambulatory BP monitoring?
Well, there are so many times when you cannot check your blood pressure. For example, it is now proven that your nighttime blood pressure is very closely associated with your risk of having heart disease or stroke. But nighttime or sleeping blood pressure is virtually impossible to check either by the doctor or even by yourself, because you will have to wake up to do it. So ambulatory blood pressure is a device you tie it around your cuff and it stays with you throughout the day. You do not need to stay hospitalized. You can do your normal things, and it keeps checking your blood pressure every 15 minutes, every 30 minutes, and it stores in the memory. And this gives you a correct information of your sleeping nighttime blood pressure. And if that is elevated, even if your daytime BP is normal, you will stay at a higher risk of getting strokes or heart disease, and therefore we need to effectively control. That is called ambulatory blood pressure monitoring.
Okay. That is totally new information for all of us. Is it okay to take medication for BP control?
Absolutely, it is mandatory, because blood pressure medicines only control the blood pressure, they do not cure the disease. So if you take a medicine which works for 24 hours, the blood pressure will stay under control only for 24 hours. The next day it will again go up if you do not take the next dose. So you have to keep checking your blood pressure regularly and keep taking the tablets lifelong without waiting for symptoms to appear.
Okay. Doctor, I have this very major question. Does BP medicines harm kidneys?
Well, quite the contrary. A lot of people have this perception that once they start a medicine, either they would get used to it, addicted to it, or in the long term, they will cause kidney damage. Actually speaking, hypertension or high blood pressure damages the kidneys. But if you take the medicines and control your blood pressure, your risk of kidney disease actually reduces. So your tablets not only control blood pressure, but they are protective for your kidneys also. So they will stop you from developing kidney disease. So that is a very, very wrong misunderstanding that people have, which we need to correct.
Yes, and it's a very commonly asked question as well.
Very,
that
most common.
medicines harms the kidneys or not?
That's the first question everyone asks. The first time when I write a medicine,
Yes.
is it safe for my kidneys?
Yes.
So yes, all your medicines are safe for your kidneys. We would never write anything which is not safe for you.
All right. Doctor, diabetic patients have always majorly high BP. Is it just a coincidence?
Well, actually speaking, diabetes, hypertension and obesity, these three are called partners in crime. They all have the same basic disease mechanisms which lead to progression of the disease, and they have a very high risk of developing heart failure, heart disease, stroke, kidney disease, etc. They all have to be treated effectively with lifestyle changes like diet, exercise, stopping smoking, alcohol, regular exercising, good sleep, stress management, and effective medicines. So they all work together to damage the body from inside out.
Okay. Sometimes spouses complains of their partner snoring too much. So does this have any connection with hypertension, high blood pressure?
Yes. This is a condition called obstructive sleep apnea, which is very common with very obese people.
Okay.
They have a lot of fat deposition, not only inside on the belly or on the thighs, but also along the vocal cords or along the windpipe. This makes the muscles lax, and when they sleep in the flat position, they fall over the windpipe and they cause obstruction. This obstruction produces that snoring sound. So it is not only a question of inconvenience, but actually it reduces oxygen levels in the night time during sleep, and that disturbs their sleep. Because of this, in the daytime they remain very sleepy, they do not have energy, they do not feel active. And this is not just limited to this. They have a very high risk of having heart failure, hypertension, and also an abnormal heart rhythm condition called atrial fibrillation. So this has to be very effectively diagnosed and treated. The surest way to stay away from this is avoid obesity. Just control your weight. And how to diagnose? There is a test called sleep study. We tie a lot of electrodes to the person, and when he goes to sleep, we check his heartbeats, blood pressure, oxygen, whether his breathing is stopping during sleep or not. And based on that, if we diagnose that this person has a severe sleep apnea, a ventilator therapy is given. He has to apply a mask, and home ventilation is given, and this can effectively treat all these conditions. So this is a serious condition. Your partner sleeping at night is not something to just ignore. It requires serious medical attention.
Okay, that's totally useful information. Thank you, doctor. Doctor, if the BP is low, then is it true that the risk of stroke and heart disease is also low?
Well, we can say that compared to someone whose blood pressure is high, a person whose blood pressure remains normal is at lower risk of heart disease and stroke. But it does not mean that these things would not happen. Why? Because hypertension is one of the important risk factors. but it is not the only risk factor for heart disease and stroke. Besides hypertension, there are many other risk factors like diabetes, obesity, smoking, stress, physical inactivity. All these also have to be effectively prevented, controlled, or treated so that your overall health remains good and your risk of having heart disease and stroke reduces.
And this is also one of the very common questions. How should one take BP medicines?
Well, ideally speaking, we need to have a uniform 24-hour blood pressure control. That is to say, your blood pressure should stay in the normal range entire day and night over a 24-hour period. So what we do is we prescribe long-acting medicines. A tablet which works for 24 hours, if you take in the morning, the effect will stay till the next day morning. So it will actually not matter whether you take in the morning or afternoon or night. So what we recommend is that you pick up whichever time is convenient to you and take medicine exactly at that time every day. If morning breakfast time suits you, take it at morning. If night time or dinner time suits you, take it at night, but always keep it same. Sometimes morning, sometimes evening, do not change your time. A long acting tablet will give you effective 24-hour control. But as I said, nighttime blood pressure control has even more significance than daytime control. So therefore, if you're not sure whether your tablet is 24-hour acting or not, whether it is that much long acting or short acting, it is preferable to take your BP tablets at night time, because it will certainly control your nighttime blood pressure so that your risk of having heart disease and stroke will remain low.
Yes.
That's it.
Totally get it. Thank you, doctor. The information you have shared with us, it's really useful and it definitely increases the knowledge about hypertension. Thank you for your time.
Thank you so much. I hope it was useful and productive.
Yes, absolutely.
Thank you.